So good day, I'm Hayan Batara, and for today's procedure, I'm going to assess the pulse rate. So pulse rate is the wave of blood in the artery exerted by the contraction of left ventricle during a cardiac cycle. So it provides information on the regularity of heartbeat. So the purpose of it is to identify the patient's heart rate, to assess the strength, regularity, and character of the pulse, and to monitor changes in the client's health status. So the first procedure that we're going to do is we have to identify the client and explain the procedure to the client to obtain informed consent. So this is to ensure that you are doing the right procedure. So, good morning, sir. I'm Haim Latara, and I'm going to be your attending nurse for today. So, sir, what is your name, sir?
Mohammed Bilal El Batra.
Oh, okay. So, gather the necessary equipment and then bring to the bedside. So, this is to promote the efficiency of the healthcare provider. So, here is for you. Next is adhere to local infection control policies and ensure proper hand hygiene, hand washing. So this is to avoid the transmissions of the microorganisms. Next is place the client in a comfortable position, either in a sitting or supine position. So this is to provide a comfortable access or on pulse site. So, sir?
I like to sit.
Comfortable, sir? Or
Yes.
okay. So, fifth is we have to provide the privacy. So this is to maintain the client privacy and promote the comfort. For this procedure is we have to assess the radial pulse. So to check the radial pulse, position the client's arm along the side of the body or across the upper abdomen with the client's wrist relaxed and palms either facing upward or downward. So this is to relax the position of the arm and promote easy access to the artery. So next is apply the light pressure with the pads of the fingers in the groove along the radial or thumb side of the client's inner wrist. So be careful not to apply too much pressure as this can impair blood flow. So the pads of the finger can feel the pulsation as they are sensitive. So identify the pulse, feeling for the characteristics wave-like sensation. So this is to determine if it is normal or there is any abnormalities. So looking at the clock or watch with the second hand, count the number of the beats over 60 seconds. So this is to ensure the accuracy of the counts taken. So the next is we have to assess the bilateral. So this is to assess the other side. So, during or after counting the rate, assess for pulse rate, rhyme, quality, and amplitude. So this is to determine the findings if there are any abnormalities. So now, we're going to assess the apical pulse. So, clean the earpieces and diaphragm of the stethoscope with alcohol wipes or cotton balls with alcohol. So, discard wipes or cotton balls properly. So, this is to reduce and avoid the transmissions of the microorganisms. So, with the client supine or sitting, expose the left side of the chest, but only as much as necessary. So, this is to move the apex of the heart closer to the chest hole. So palpate the fifth intercostal space at the midvascular line by sliding your finger down from the sternal notch to the ankle of loose, the bump where the manubrium and sternum meet. Then, slide your finger over to the left sternal border to the second intercostal space. And then now place your index or ring finger in the second intercostal space. And then count down to the fifth. So this is to determine where the apical pulse and where the heartbeat is normally heard loud and clear. So the intercostal space, by placing a finger in each of these spaces, slide over to the mid-clavicular line, keeping your fingers in the fifth intercostal space. The palpated apical pulse is also called to the point maximal impulse. So warm the stethoscope in your hand for 10 seconds and then place the diaphragm over the PMI and listen to the normal sound of the heart. So a cold stethoscope may surprise the patient and then after the pulse rate. So count the beats for a full minute using watch with the second hand. So this is to obtain the accurate comfort of the breaks. So place back the patient's clothing and place comfortably in bed. So for the patient's privacy and comfort. So here's okay. So during or after the counting rate, assess for pulse, rate, rhyme, quality, and amplitude. So this is for the assessment gives the result of the findings. So assessing the brachial pulse, using firm pressure with the pads of your forefinger and index fingers, press the inner aspect of the antecubital fossa until you palpate the brachial artery. So to locate the brachial pulse with the pads of the fingers. So if you have difficulty palpating the brachial pulse, ask the client to pronate the forearm. So for the better accuracy in finding the brachial pulse. So identify the pulse, feeling for the characteristic wave-like sensation. So this is to determine the beat if there is any abnormalities. So count the beats for a full minute using a watch with the second hand. So standard time ensures the accuracy of the counting. So assess the bilaterally. So this is to assess the other side. So during or after counting the rate, assess for pulse, rate, rhyme, quality, and amplitude. So this is to provide the additional assessment data. So assessing the carotid pulse. To check the carotid pulse, place your finger on the client's trachea and slant them to the side into the groove between the trachea and the sternocleidomastoid muscle. So this is to locate the side of the carotid pulse. So palpate the carotid artery lightly and pressure on the carotid. As carotid can stimulate the vagus nerve, causing the pulse and BP to drop suddenly. So too much force disrupt the pulse. So identify the pulse, feeling for the characteristics wave-like sensation. So this is to determine the beat if there is any abnormalities. So do not palpate the carotid pulse except during cardiopulmonary resuscitation or DCPR in an adult and in certain situations to assess for circulation to the head. So carotid pulse is sensitive. So during or after counting the rate, assess for pulse rate, rhyme, quality, and amplitude, provide the additional assessment data. So assessing the dorsal pedis pulse. So palpate the dorsal pedis pulse by running the pads of your finger up to the groove between the great and the first toes of the top of the foot. So this is to locate the place of dorsalis pedis pulse. So palpate very lightly because these are So palpate very lightly because the dorsalis pedis pulse is easily obliterated. So to avoid obstruction of false rhythm. So to identify the pulse, feeling for the characteristic wave-like sensation to assess the other side for the similarity. Assess bilaterally and to assess the other side. So during or after counting the rate, assess for pulse rate, rhyme, quality, and amplitude, provide additional assessment. So, assessing the femoral pulse. So, palpate the femoral pulse by pressing deeply in the groin midway between the anterosuperior iliac spine and in the symphysis pubis. So, to locate the site of the artery in the femoral pulse. So the femoral artery lies very deeply and requires significant pressure to palpate. You may need to use both hands to feel the femoral pulse on an adult. So more pressure makes it easier to find the pulse site. So identify the pulse, feeling for the characteristic wave-like sensation. So this is to determine if there are any abnormalities. So looking at the clock or watch with the second hand, count the number of the beats over 60 seconds to ensure the accuracy of the counts taken. So during or after counting the rate, assess for pulse, rate, rhyme, quality, and amplitude. So this is to provide the additional assessment data. Not yet. So assessing the posterior tribal pulse. So palpate the posterior trivial. So palpate the posterior tibial pulse by pressing on the inner medial side of the ankle below the media malleus. So this is to locate the posterior tibial pulse. So press down moderately and then increase the pressure until you feel the pulse. So this is to ensure the location of the pulse. Identify the pulse feeling for the characteristic wave-like sensation to assess the other side for similarity. So, looking at the clock or watch with the second hand, count the number of beats over 60 seconds. So, this is to ensure the accuracy of the beats. So, assess bilaterally. So, this is to assess the other side. So, during or after counting the rate, assess for pulse, rate, rhyme, quality, and amplitude. Provide the additional assessment data. So you'll start counting and then count to the pulse rate simultaneously for 1 full minute. So this is to have an accurate findings. And the next is assessing the popliteal pulse. So palpate the popliteal pulse by pressing behind the knees in the middle of the popliteal fossa. So this is to locate the location of the popliteal pulse. So press down moderately and then increase the pressure until you feel the pulse. Avoid obstruction of the pulse reading. Identify the pulse feeling for the characteristic wave-like sensations to assess the other side for the similarity. So looking at the clock or watch with the second hand, count the number of beats over 60 seconds. So this is to ensure the accuracy of the counts taken. Assess bilaterally, so this is to assess the other side. So during or after counting the rate, assess for pulse, rate, rhyme, quality, and amplitude. So this is to provide the additional assessment data. So assessing pulse deficit. So to assess for a pulse deficit, you will need another health worker when one person assess the radial pulse rate while the other person assess the apical pulse rate simultaneously. So to properly locate the deficit pulse. So position the patient either in a supine or sitting position and expose the patient's sternum and on the left side of the chest. So this is to expose the sternum in comfortable position. So using the appropriate and automatical landmarks, locate the radial and the apical pulse for proper location of the radial and apical pulse. So after is you have to stop counting. So this is to determine the pulse rate.
Oh, I'm going down.
Wait.
Just use orange
Wait.
for the rest of the video.
So to calculate the pulse deficit, subtract the radial pulse rate from the apical pulse rate. So this is to get the pulse deficit result. So if you find a pulse deficit, assess the patient for the other signs and symptoms of the decreased cardiac output, such as dyspnea, fatigue, chest pain, and palpitations. So this is to provide additional assessment data. So we have to document the reading and rhyme of the amplitude irregularities on the observation chart immediately. So compare this figure with previous pulse readings and then taking into consideration to the patient's clinical condition. So this is to see if there is any abnormalities. So assessing the temporal pulse. So palpate the temporal pulse by pressing lightly the lateral outside area and superior above the eye. This is to properly locate the temporal pulse. So identify the pulse, feeling for the characteristic wave-like sensation. So this is to assess the pulse if there is any abnormalities. So during or after the counting the rate, assess for pulse rate, rhyme, quality, and amplitude. So to provide the additional assessment data.